Cornea is precious, but how delicate is it? And how nervous should you be helping your patient? The purpose of this video is to make sure that primary care physicians, young ophthalmologists, other young doctors are not afraid to take away these kind of superficial metal foreign bodies that are quite common. And the instruments I have used in this video is this kind of burr that is not drilling or anything like that. It is polishing or shaving a little bit on the surface. It's very good to take away extra rust particles. And the other instrument is this instrument to take away metal foreign bodies. You have the sharp end that looks like this. It's good when you do detailed works. And you have this more blunt, and sometimes you feel like you need this one also. In this video, I have a volunteer patient who has given his written consent that I violently attack his cornea. The reason I can do this and that he's okay with this is because the eye is blind and painful, and we have decided to take away the eye. So these two videos of the burr and the other instrument is done just prior to taking away the eye. And what I do here is too much. I violently attack the eye as hard, almost as hard as I can, without stabbing it. As hard as I can without stabbing it, just pressing as hard as I can. And as you will see, I will not penetrate the cornea. I didn't even get a little bit inside the cornea. Of course, you should never do this to an eye, but when you are taking away metal foreign bodies, it means that when you do it in a cautious, civilized manner, you should not be afraid of the risk of penetrating cornea, at least not with these instruments. Some people use needles, cannulas to take away foreign bodies, and of course if you have a fine needle you could penetrate cornea, because sometimes we go inside anterior chamber with small little needles, fine needles. But at least with these instruments, if you have a normal cornea and you behave in a civilized manner, as all of you will do, you will never attack it like I did, even though you have never taken away a foreign body before. You will not penetrate the cornea. And yeah, you should have the patient all the way here in the front, with the front of his head here, or her head, in front of the chin here. Then the patient cannot come any further. And with your hand, you have the hand resting to the microscope or to the patient's forehead, and by that way you have a nice stability, and there will be no stabbing surprises or anything like that. Yeah, enjoy the video. Extra caution can also be when you take away foreign bodies from the very central of the cornea, because you don't want to create a scar that is in the visual axis. And for that reason, in Sweden at least, we usually offer the patient to have foreign bodies in the pupillary area to be taken away by an ophthalmologist. But some countrymen will say, no, I won't go to the city. Do it for me, please, primary physician. I want to stay here in the countryside. And then you can do it too. One more good thing to know is that you can take away a metal foreign body in 2 steps. If you've done your best and you really cannot get everything away, then you can actually give the patient some antibiotic anointment like chloramphenicol, an ointment or something like that. Take the patient back in 2 or 3 days, and by then the rest of the metal is usually easier to take away because the surrounding tissue has also become a little bit softer, and so that's a good tip. The bar is making a lot of noise, but it's basically only polishing and it's quite gentle. This specific eye was not a soft eye. It had a high pressure, very high, of 50 millimeter mercury. And although I tried my best to press very hard with the instruments, I didn't go through the cornea. Its surface has some irregularities, but otherwise this cornea was totally healthy. Now I am going berserk here, berserk pedagogics, but you should still be cautious and careful. I'm just showing you this so that you are not that afraid of helping the patient while you're doing it in a civilized manner. This instrument could possibly penetrate a thin and diseased cornea, but generally the patients with these superficial melt-in foreign bodies that they have gotten from welding or sewing or grinding metal, these superficial metal bodies, these young working patients usually have perfectly healthy corneas. If you instead see a metal foreign body or other type that is deep into cornea, that has gone with high velocity into the cornea, then an ophthalmic surgeon should take care of that instead. And he or she would probably use other instruments. Good luck.